Welcome to another episode of Park Avenue Plastic Surgery Class, the podcast where we explore controversies and breaking issues in plastic surgery. This is your co-host, Doreen Wu. I'm joined by Dr. Lawrence Bass, Park Avenue plastic surgeon, educator, and technology innovator. This episode title is Kiss and Tell, revealing all the ways plastic surgeons can beautify your lips. I'm excited to jump into today's episode to really understand what makes a beautiful lip and how plastic surgeons can make lips more beautiful.
This is really an episode for everyone of every age, male or female. Lips are a central beauty feature on the face and very popular for a little boosting, reshaping, or other modification. If we look at the makeup industry, lipstick is the single most inflation and recession-proof product for good reason. This is a little less true right now since we're all wearing masks in the pandemic, but we all still want to look good both to ourselves and when we get on those Zoom meetings and on FaceTime.
Everyone always thinks about lip augmentation and have this image in their head of big, full, bee-stung lips. Dr. Bass, when it comes to lips, is it true that size matters?
Well, size is a big part of it. Enlargement or augmentation of the lip, this was a big starting place in the aesthetic treatment of the lip. Even before we had modern injectable fillers, various things were implanted or injected into the lip to build a bigger size. In modern plastic surgery, things like Gore-Tex was slipped into the lip to build the size. Silicone was injected in the lip. Many other things historically in plastic surgery. So this is definitely something that has captivated interest over many decades. Back in the 1990s, in the early 90s, when collagen injections were the available filler, one of the principal and most popular uses was for lip augmentation. In the era of modern fillers like Restylane and Juvederm, this became longer lasting and even more popular. It's a treatment that's popular in young adults and in a number of decades of older adults going forward from there. The question always is, how big is too big? Should the lips look obviously bulging, the bee-stung look, or just in balance with other features? That's a question of personal taste more than anything else. Like everything in plastic surgery, I personally think finesse and some understatement works best, but how much or how big is definitely partly a product of the projection of the rest of your features and the look you're going for.
So bigger is better, at least up to a certain point. Is that the end of the story for lip injections and fillers?
Not really. In fact, it's just the beginning. Actually, in my view, it's a secondary issue. Size is part of it, but the most important feature of a beautiful lip is shape. The lip has curves, bulges, dimples, and peaks. The beauty of injectable fillers is the incredible shape control that we have using them, which far exceeds that which we see in surgery on the lip. Based on the amount and exact location of placement, we can really control the shape, the size, and the gestalt that the lip projects.
Can you talk about some of the shapes and styles? In other words, what makes a beautiful lip?
So again, it's not an across-the-board big size or uniform size. The lip is always curving and contouring as you transition from one part to another. And those shape differences need to be maintained for the lip to look natural and for the lip to look attractive. The upper lip and the lower lip have completely different shapes. And so again, just uniformly augmenting the upper or the lower takes away some of that distinction and looks unnatural. The upper lip tapers towards the side fills towards about 2/3 in from the side, and then has a little bit of an empty space before the central pucker or tubercle. That's the central part of the upper lip. Now here I'm talking about the pink part of the lip, what we call the vermilion in medical terms. That's not the only part of the lip, though. We have white lip, the skin of our lip, and we have the white roll, which is the transition zone, that little zone of thicker skin in between the pink portion of the lip and the white portion of the lip. In the white roll, we have something called Cupid's bow peaks. And in the white lip, we have philtral columns. We have similar rolls of skin to the white roll that go down from the nostrils to the Cupid bow's peaks. So all of those shapes should be visible and they need to be in balance. Lower lip shape is a little simpler. The classic description of the lower lip shape is a double pillow look. So fullest, again, about 2/3 of the way in from the side, with a little less fullness right in the center. A simpler shape, but still a very important shape for the lip to look natural. There are also considerations of the size of the upper and lower lip relative to each other. The lower lip typically looks bigger than the upper lip. The upper lip will be 2/3 to 3/4 the size of the lower lip, so it's a little bit smaller. Not half the size, but 2/3 to 3/4. The final consideration in lip shape is symmetry improvement. A lot of people have small asymmetries on the face. Almost all of us have very small asymmetries. All of us do. But many people have moderate asymmetries on the face that manifest in the lip as a difference in length, a difference in fullness. And these symmetry differences can be minimized using injected fillers. However, we can't eliminate them because there are many things that are responsible for that asymmetry. And just for starters, the skin envelope is different on the two sides, and that limits the ability to completely remove the asymmetry.
This is likely a question that many people have. What happens to the lip during the aging process?
That's a really important question. And like almost every other part of our body, as we age, our lip loses some of its real power, beauty, and appeal. And it loses it for several different reasons. We lose some of the curviness. The lip thins or becomes smaller. And again, this applies to both upper and lower lip. We see less of that vermilion or pink portion of the lip. This is caused by multiple factors that cause the vermilion to roll in and less of it be rolled out where it can be seen. Bone loss as we age, lengthening of the upper lip, and intrinsic volume loss in the lip all contribute to a loss of vermilion show. We also lose definition of the white roll, including Cupid's bow peaks and philtral columns, and we start to develop fixed and dynamic wrinkles. And what I mean by that, fixed wrinkles are wrinkles you see when the lip is in repose, and when you animate, you talk, you smile, you eat. Dynamic wrinkles are the wrinkles that form when the muscle is buckling the skin because it's in action.
What role can Botox and fillers do to combat that?
So there are a number of treatments for these aging changes that Botox and other neuromodulators and fillers help us with. We do treatments to restore the volume, to restore the shapes that are lost using injectable fillers. We can put injectable fillers into the wrinkles superficially in the skin. That helps us to an extent. It blunts the appearance of the fixed wrinkles, and it also stiffens the skin a little bit, which blunts the dynamic wrinkling. The main treatment for dynamic wrinkling is Botox, which can soften the amount of buckling the upper lip skin undergoes when we talk, smile, or animate. There are a couple of other things that Botox, Dysport, Xeomin, and Jeuveau are being used for. One is the gummy smile. That's not really an aging change, but people who show not only their full teeth, but some of their gums when they smile, that's sometimes seen as an unattractive smile. Again, not really an aging change, but you can relax the muscle a little so it doesn't pull up quite as hard and get more of a full tooth smile. Or you can even relax things further and come to just that trace of a smile, the Mona Lisa smile. Another treatment using Botox and neuromodulators that's really popular and really useful is what's called the lip flip. By relaxing certain portions of the upper lip muscles, you can promote rolling out of the vermilion. Remember, I said the vermilion or pink part of the lip rolls in and we see less of it as we age. But by relaxing certain parts of the muscle, we can get that lip to roll back out, showing us a little more of the vermilion.
We've been talking about non-surgical options so far. What can plastic surgeons do in the operating room to help the lip?
Operating on the lip is something that's very central to plastic surgery. This comes from the reconstructive legacy of plastic surgery, treating trauma to the lip and treating things like cleft lip and cleft palate. Cosmetic treatments of the lip, though, using plastic surgery are also a mainstream item. One of the treatments for cosmetic treatment of the lip, if the lip is overly large rather than too small, is lip reduction. There's less surgical lip augmentation these days than there used to be because the risks of implanted materials in the lip, Gore-Tex, silicone implants, and other types of lip augmentation, in the long run end up being riskier and also having distinctly less precision and shape control than injected fillers have. So lip augmentation using surgery is not as common as it was 20 or 30 years ago. The mainstream treatment for surgery of the lip, which is really an aging lip treatment, is the lip lift. And the other main treatment being done on lips and, in fact, in the entire perioral area of the upper and lower lip are a variety of wrinkle treatments using energy-based devices like laser peels, non-ablative laser, radiofrequency microneedling, and chemical peels to peel down the wrinkles and even up the skin so that it's smoother, flatter. So this is a treatment not for dynamic wrinkling, which is, again, Botox, but a treatment for fixed wrinkling, which many people have in their lips, the so-called smoker's lines or lipstick bleed lines, which mostly in actuality are from sun damage. The lip lift surgery takes out a wedge of skin located just under the nostrils. That's where the incision tries to hide. And lip lift surgery involves a lot of differences in technique depending on what each individual needs, and it can accomplish several different things. The lip lift can roll out the vermilion. It can help elevate and sharpen the corner of the mouth. As we age, our typical youthful upturned corners start to sag down, and that takes us from the smiley face to the frowny face. So lip lift can help us boost that back in position, and the length of the white lip, the height from the nostrils to the vermilion, increases as we age. A long lip is an old-looking lip, and a shorter lip is a younger-looking lip. So by taking that wedge of skin out, you can shorten the height of the white lip, creating a more youthful appearance. The main pitfall of the lip lift is the scar, or if it's not artistically done, you can create an exaggerated or unnatural look, a lip that's too upturned or upturned in an unnatural portion or direction. Lip lift is something that's done everywhere in the United States, but particularly popular on the west coast of the United States, but common and popular in the Northeast and everywhere else at this stage of the game as well.
Speaking of pitfalls, what are the pitfalls with fillers? How can they be avoided?
So there are a number of pitfalls with fillers, but the good news is they're relatively easy to avoid if you're working with an experienced injector who has good technical and artistic skills. And so it's something we don't need to be afraid of. We always see the unnatural examples, and we don't see all the beautiful work that just walks past us looking good, but is definitely been treated with plastic surgery and injectable fillers. So one of the biggest pitfalls is enlarging the lip without maintaining the curves and shape that are natural to the lip. Either pumping up the lip across the entire length, creating sort of a sausage-like look, or just pumping up the corners of the lip, which is a very fast and dirty injection technique. You put the needle in once at each corner of the upper lip and squirt in a bunch of filler. That creates an intrinsically unnatural look. Now, there are so many folks who have that look, and it's in so many of the fashion magazines, that I've actually had patients come into the office and ask for that. And if you like that look for some reason, that's okay. But it's important to recognize that is an intrinsically unnatural look that humans who have not been treated don't possess. The outer portion of the upper lip should be tapering towards the corner. It should not be fullest at the corner. In times past, and particularly with collagen, which was a much softer injectable than the current injectables, most of the injecting in the lip was on the white rolls, that transition zone between the pink and white lip. And that's what's responsible for giving people a duck-billed look. There are portions of the white roll that can be injected and look good, but if that's overdone or it's done all the way across the lip, you end up with a duck-billed look, which again is unnatural and most people are trying to avoid.
What about when it comes to Botox? What are some of the pitfalls there?
Yeah, so Botox in certain areas of the face, we're trying to get target muscles completely asleep because that's aesthetically desirable and there's no functional consequence. In the area around the mouth and the lip, a little is good, but more is not better. We need to maintain a good level of function so you can speak, swallow, drink, seal the lip, and overdoing it in this area will make unnatural motion and eventually the inability to function adequately. So we have to accept that we can get some nice effects with Botox in the oral area. It's an advanced injection area, not for beginning injectors, but it's really an excellent treatment for many features in the lip and perioral area. But we have to accept the limitations and not overdo it.
I never realized all of the complexity surrounding the lip. It was really interesting to hear the different ways in which plastic surgery can help people achieve beautiful lips. This episode has definitely given me a lot to think about. If you think of other trends in plastic surgery that you would like us to explore in upcoming episodes, feel free to reach out. See you next time. This is Doreen Wu, thanking you for joining Dr. Bass and me for this discussion of beautiful lips and plastic surgery. Be sure to join us next time for our episode discussing new FDA regulations for breast implants that went into effect October 2021. Stream the episode to find out about new consent processes and the new black box warning on breast implants in the United States.
Thank you for joining us in this episode of the Park Avenue Plastic Surgery Class podcast with Dr. Lawrence Bass, Park Avenue plastic surgeon, educator, and technology innovator. The commentary in this podcast represents opinion. This podcast does not present medical advice, but rather general information about plastic surgery that does not necessarily relate to the specific conditions of any individual patient. No doctor-patient relationship is established by listening to or participating in this podcast. Consult your physician to advise you about your individual healthcare. If you enjoyed this episode, please share it with your friends and be sure to subscribe to our podcast on Apple Podcasts, Google, Spotify, Stitcher, or wherever you listen to podcasts.